Medicaid and individuals with disabilities. What are the Medicaid coverage types for individuals with disabilities?
And similar in most states, we have two types of coverage for individuals with developmental disabilities or intellectual developmental disabilities. And we call that DD or IDD. And so there's two things that we can do. One is in our regular Medicaid program, there are services that we would cover for anyone. Inpatient care, hospital care, pharmacy care. And those are called our state plan services. Anyone that qualifies for the program gets those services. And then we have a special program called a waiver program. If you qualify, then you get a special set of benefits. So you could, as someone with DD or IDD, you could get in our regular Medicaid program and get services, or you could get in our waiver program and get our regular plus some enhanced services that are targeted towards your peer group or, other individuals in Medicaid that have similar conditions.
What disability makes you qualify for Medicaid?
So there's two types of disabilities that we focus on. One is obviously you can have a physical disability, and that could be a result of a chronic condition. And then we have developmental disabilities. Some of those happen in early childhood, right after birth, or maybe they are identified in the first couple of years after birth. And obviously we have disabilities that could be a result of an accident. For example, services for folks with traumatic brain injury. Any of these types of things, or a combination, could qualify you as having a disability for the Medicaid program.
How do you obtain benefits?
We would encourage people to do is they would go down to their county social services office, and we call these now zones. We don't call them counties. The first thing to do is sit down with one of our eligibility workers. And they're going to ask a lot of questions about what are the types of conditions you might have, what does your income look like, do you have a car? They'll go through a series of questions that they'll ask, and they will assist with filling out an application. That can also be done online. While you're there, if you're filling out the application, they will also screen you for some other programs as well. Perhaps you might qualify for a program we have that helps with paying your electric bills during the winter. If you've talked to them about the fact that you feel like you have a disability, there's a second set of eligibility requirements that you'll go through. And essentially we're looking at screening those individuals to see how much can they function. And we have from the federal government sort of benchmarks that we look at in terms of daily functioning and then also what your conditions are. So there's two sets. The first will be done by the zone, by that eligibility worker. And then when it comes to the waiver, we have what's called DD program managers. And they are located throughout these different zones in the human service centers, and they help do that assessment.
What is a positive benefit about North Dakota's Medicaid coverage for people with disabilities?
I think to me stand out. We try to keep folks in their home or their community as long as possible, and to me that's a benefit. We do have group homes where you leave your house and you leave your community and you live in a facility, but we also have a number of services to try and keep you in your home as long as possible with your family, with your caregiver, and that's a benefit for sure. The second is we have about 5,000 clients right now who are on that special waiver, which is a pretty robust number if you think about how many people are in North Dakota and how many people are on our Medicaid program.
What is something people may not know about Medicaid coverage?
I was struck by how many choices that you have. So the first part is, again, trying to keep you at home by yourself as long as possible. The second part is we keep you at home, but maybe with your family or maybe with a designated caregiver. We can help pay for some of that family support, direct family support. Then you move on to sort of a community-based setting. So you might actually live at home, but you may go to a day center during the day. Then if you further on the continuum, you might live in one of these group homes. And then finally, if you have an acute condition, we have ways to, if you need to go to the hospital or if you need to go to a nursing home as well. I was struck by how many points are along that continuum and how the state is really pushing people towards the end, keeping them in their homes and keeping them in their communities. But we have to make sure that all of those pieces are available because you as a client might say, well, I just can't stay in my home. It's at that point that I'm ready to move on to a facility.
What doesn't Medicaid cover?
So of course there's going to be a list of things that families might need or providers might want that we don't pay for. In terms of, again, along that continuum, it's going to depend where you are. So as you are in that group facility and you're living there, obviously everything that's covered within the four walls of that have to be covered. It's part of what we would contract for. But when you get to the home and community-based part, I think Medicaid could do a better job, and we're focusing on this, is getting you more assisted technologies to help you stay in your home, helping you make adaptations to your home. We certainly provide dollars for that, but we could probably always provide more.
Who helps families work with questions about Medicaid?
So there's a couple of ways that families can ask questions. Your provider. Just because you have a developmental disability or an intellectual and developmental disability, you still have a primary care provider. You still have a specialty provider. And so those types of providers, you should also be able to ask them and their staff about the Medicaid program. We have 2 call centers in the Medicaid program where members can call us directly. There are advocacy agencies. For example, Family Voices is a local organization in Bismarck, but they help families whose children have special health care needs. They help them all throughout the state. So there's a number of different ways, whether you choose to work with the local level with the county, at the state level with us through the call center, or outside of government through one of these advocacy agencies.
North Dakota. Be legendary. State Council on Developmental Disabilities. Human Services. www.nd.gov/SCDD